Hey guys, down here, welcome to Podiatry Practice Mastery. We're going to go over this $1 Million Minute here for the day. This is a recording for Monday. Okay, so this was a day we've been struggling a little bit. I think some other practice have told me the same thing. We're struggling to find some medical assistants. A while back, we had a couple of medical assistants, and they were doing some time theft for us. I don't know if you have ever found this in your practice, but they were coming earlier, checking in, and really just kind of sitting around and chatting. And when we called them out, they confessed, right? And then they promptly got other jobs. We didn't make them leave, but they ended up leaving our office. This is something just to kind of be aware of. This is something I'd never seen before, but they came in early, and they were just kind of sitting around drinking coffee and shooting the breeze. So it's just something to consider. Making sure that when they're working, they're actually doing things in the office. This was a day there was two doctors in the office, and there was only one medical assistant. So she was like working crazy, and I was having to have to help out. And the funny thing is, I realized I don't know where a lot of the things are, tube sock and things like that for ingrown toenail procedures and everything else that I was doing. So that was one of the things that I've learned. Also, I think I've told you before, I'm dealing kind of with my dad, and then I got this crazy phone call, like he had like explosive diarrhea at home and incontinence and stuff like that. So these are like stressors that happen during the day, and we're trying to see the patients, but ultimately everything kind of worked out. It wasn't all that bad. To me, maybe for my wife it was. Okay, let's go here. So for the day, first patient was a wart where we did a lesion destruction, little 9-year-old boy. He had canthared in for a couple of treatments, and looks like was almost gone. Usually when they're almost gone, that's where I do one more treatment with silicone, and I don't have a follow-up for them. Next patient was an orthotic follow-up. He had first met pain, and he was here for an orthotic follow-up. He was doing fine. So just an office visit with a 1-year follow-up. Next was a 47-year-old. This is a guy that's trying to run a marathon. He has a wart, so I did canthared in on his toe. He was also dealing with some ankle instability, and he was being seen for physical therapy. Next was a 37-year-old new patient that came in for an IND of the left hallux. No follow-up for that. Next was a number 3 out of 6. Shockwave for plantar fasciitis, and we also scan for orthotics, so I tend to do the scanning for the orthotic at the third visit, so that was orthotic number 1 for the day. Next was a 48-year-old that we did focused only shockwave on the second metatarsal for a stress reaction to the second metatarsal. So we're going to do 3 total for him, only because stress fractures or stress reactions, I don't know, maybe I'm just not used to doing 6, but I'm just doing 3 and just focused only for him. Next was a 63-year-old patient. He had plantar fasciitis. He didn't really come in for that. He came in for an IND of his right great toenail. But he also had plantar fasciitis that really was there for years, and he isn't wanting treatment. I'm not sure if it's the price of the shockwave or he thinks it's going to get better with time. He's tried different shoes, but I did recommend shockwave for him. He has it bilaterally, but he's going to think about that. So in the past, I used to try to, convince patients that they need it because I know it'll make them better, but if people aren't ready, I just let them go. So I let them go, didn't make a follow-up, and when he's ready, he will call for the next step. Next patient was a 29-year-old that had a matrixectomy on bilateral medial edges of the great toe. She didn't have it prior because she was pregnant, but now that she had her baby, she could do it. Next was a 54-year-old female that had a CaryFlex. So now is the time of the year that patients are coming in for their yearly CaryFlex because it's the spring. Next patient was a new patient. She had bunion, hammer toes, and needed nails and calluses. She was not interested in bunion surgery or anything else like that. I gave her shoe recommendations. She was 79, so she was content with that. She had this was one that had a lot of questions, and I just kind of had to excuse myself from the room. So sometimes they kind of get us in this conversation, and this and this and this and this. And those are kind of challenging situations, so I usually just try to be polite, but then I kind of excuse myself and say we can deal with the shoes now, and then you'll come back as needed. So once again, her, I did not make a follow-up. If those shoe things don't work, then we'll go to the next step with her. Next was a 78-year-old female that she's going to Disney, and she had heel pain, so I did a cortisone injection in her heel prior to a trip. That tends to be when I do more cortisone, is when people are going on trips or they have special events coming up. Next patient was a nail sample that I did, and then I'm going to see her back in 2 weeks. I think the main reason I didn't go directly for the terbinafine in this one is because I was just so busy and backed up. So I sometimes use a quicker visit as a way to buy me back some time. And so, I have been typically going right to terbinafine right away, but I did the nail sample first. I'm going to see her back, and then we'll do the terbinafine at that time. Next patient was an 84-year-old. She's a female that's older. She has bone-on-bone arthritis to the ankle. I had done a cortisone injection just a few weeks ago. It didn't really help her. I talked to her about an AFO, like an Arizona AFO, or possibly referring her to one of my colleagues for a fusion of the ankle. The challenge with her is like age, right? 84. She needs a right knee surgery, and she actually canceled her knee surgery because her ankle is hurting her so bad. So she's going to see one of my buddies for that. Next was a patient that was a Lamisil follow-up, and she wasn't really seeing the improvement with the Lamisil, so I switched her over to diflucan as the second type of medication. Next patient was a new patient. She had pain kind of to the top of her foot. I gave her shoe recommendations. She came in. This is the one that was a drag on my time. She came in like with this big box with her metatarsal pads, with her toe spacers, with everything that she's done, all the other over the counter. And really, her shoes were inappropriate for the width of her foot. Talked about shoes, and I said, you just got to try the shoes first and the UFO sandals, and then come back, because she was just going down this black hole that I couldn't get her out of. Next was a EPAT number 5 out of 6 for plantar fascial pain. Actually, this was posterior tibial pain. Next was number 5 out of 6 as well for plantar fascial pain. Next was a 32-year-old patient that she had a wart on the 5th met head. I did lesion destruction. She's going to come back as needed. Next was a patient that came in for a 5th met base fracture. So it was a fracture code office visit, and she was actually going to be going on a cruise like in about 6 weeks, so hopefully she'll feel better for that. It was an avulsion, and I put her in a tall cam boot. And I did offer her shockwave. She was not interested in the extra price for that, but I did offer her focused only shockwave. Next was a 14-year-old for an IND. Next was a 57-year-old that had a hallux limitus on the right, with actually hallux rigid. Yeah, it wasn't rigidus. The darn thing wasn't moving, and it was rubbing against the second toe that was drifting medially. So I offered a simple exhaustectomy on the adjacent sides of those two kissing toes, and that could be done in the office, or he could do kind of a first MPJ fusion with second digit fusion. That was the other option I offered him. So he's going to think about that and let us know. Next was EPAT number 4 out of 6 for heel pain. And then the last patient was a IPJ hallux, DIPJ second digit cyst that I've aspirated before. It's getting to be summer, so girls are going to wear sandals. And they were kind of concerned about that, about like wearing sandals and how ugly it looks. So I aspirated. I did recommend possibly doing something else in the future for this patient, like an IPJ fusion, and she'll consider that. Okay, so let me go over a couple of other things that I'm doing. I did decide to hire Al. Al is this guy that helps me with he's going to help me with a newsletter for PPM, Podiatry Practice Mastery. One thing I'm trying to do is I have quite a few people that listen to the podcast, but I don't have as many people joining my membership. So he is going to set up kind of an email. So if you get any of my stuff, he's going to be doing a weekly email to help me. He's going to use my voice, use my content, but he's going to be writing it just because it's a busy time right now. But I feel like it needs to be done to help grow this. So I'm going to be investing. So what I did is just so you guys know, I opened up a business checking account for Podiatry Practice Mastery where all of the deposits of the people's subscriptions that they're paying for me go. And then from that, I'm going to be taking out to pay Al to do the newsletter. And he can do this for your practice too if you're interested, but it's a pretty reasonable price. And he will do this like a weekly newsletter, kind of in my voice, educational but also entertaining. So I'm excited to start doing that. And so what I'm gonna do for him is to set this up. I'm gonna set up a little meeting. I'm gonna tell him kind of what my expectations are, and I'm gonna send him over something called an impact filter. So an impact filter is where I think about. I write this out for him. So my desire is to multiply Podiatry Practice Mastery and increase the reach and the revenue. And I talk about what I want to accomplish, what's the difference it'll make. So I want to go from earning $30,000 to $60,000 a year with Podiatry Practice Mastery. Still, it's very minimal compared to what I earn in practice, but I think it could continue to grow over time. So I want to use a growth strategy. He recommended a lot of other things that ended up to be about $2,000 a month. I didn't feel comfortable with that. He wanted to set up a new, like, re-tier everything and set up a Facebook chat group. If you guys are interested in a Facebook chat group, let me know. Problem is, I just don't use Facebook, so he's wanting to set this thing up and so people can join it, so they can have more conversation amongst each other. I just feel like I don't spend much time there, but if you feel like you would like something like that, send me an email, don@podiatrypracticemastery.com. I would be okay with doing that. I've been trying to do with WhatsApp, but I know a lot of people don't use WhatsApp. And there is something within my website called Kajabi that has a communities. I just think we're all busy. I think of me. Do I really want to spend time on a community if I'm busy all day long? I just don't have time for that. That's where I was thinking about other methods. But there might be a certain portion of those that are listening that would like that. So what my plan is, I'm going to meet with Al. I'm going to have him reuse my content from my podcast using ChatGPT to then help create the topics in the newsletter. And all the newsletters are going to have a clear call to action for one of my core offers, like one of my audits or one of my courses or some of the free downloads or even joining one of my memberships. I'm going to continue to use stories from my family, similar ones that I use from my practice newsletter. And I'm going to have a clearer sign up for the newsletter so that people can get the newsletter. Anyone that has downloaded anything on there is going to get the newsletter as well, but I'm going to have a clear sign up. And I'm going to try to make it entertaining and also give value for the doctors. So, and then I'm going to tweak it and then grow. Then potentially after that, then we can tweak it. So he's going to be doing everything. I'll let you know how that goes as things are kind of going on. And I'm still trying to record. I haven't had a chance to, but all the insights from my last coaching session, so you can kind of know what I'm working on for this next quarter. Okay, have a great day. Thanks.